Have you ever heard the phrase that cash is king? Well, it's no different in healthcare. Healthcare providers today have to go through a pretty complex, time-consuming process called claim submission. So they've got to fill out all this paperwork, they've got to assign all these codes, they've got to submit the paperwork in. If the paperwork's not accurate, it has to be redone, and then it goes through a third-party administrator to process a claim, that they get reimbursed. It can take a month to 6 months, maybe even 9 months for a physician or provider of care to get paid. When you pay cash, that provider of care is paid at the time of service. And because they don't have to go through the complex process they do with normal claims billing, they're much more willing to take a really reduced rate for that same service. We can see a 30, 40, 50% reduction just by paying for that service at time of service. But we need you to call us first, because it does take time. We've got to reach out to your physician, we've got to negotiate a rate, we've got to kind of walk them through the process. And so if you give us advance notice, we can save you a ton of money on the service. And by doing that, by taking our guidance, remember the BowTie plan design, you can have $0 out of pocket, right? But we need the time to go negotiate these rates. The other benefit of negotiating cash payments is that we avoid something that's called upcoding or upcharging. In the industry, there's a lot of codes for everything a physician or provider of care wants to get reimbursed for. And by changing certain verbiage, they might be able to upcode some of the services provided to you to get a higher level of reimbursement. When we are paying cash up front, this is all in one inclusive price. No upcoding occurs. And we know it's paid at time of service. You have no dollars out of pocket. The provider gets paid right away. They get paid a fair price and everybody's happy. So call us early, call us first, and allow us to work on your behalf by negotiating cash payments.